Hi, I'm Chuck Cohen, Managing Director of Benco Dental, and here's my expert practice tip. Know the 4 drivers of revenue in your practice. Most dentists spend a lot of time thinking about the expense side of the practice, but that's only part of the picture for your profitability. There are 4 main revenue drivers for every dental practice. The first one is your fees. Are your fees correct for the area you're in? Are you charging the right fees for the most important procedures? The second one is your insurance reimbursement rates, because your published fees are only part of the story. Make sure that you're negotiating at the right time with your insurance providers to get the most reimbursement rate that you can find. Number 3, your procedure mix. Most dentists forget that the procedure mix is a big driver to revenue. If you're doing a lot of long crown procedures, that's one thing. If you're doing a lot of short hygiene appointments, that's another. But there are certain benchmarks that are established for practices of a certain size to make sure that your procedure mix is appropriate. And when we talk about procedures, don't forget, we're also talking about things like the number of x-rays you're taking and how many other non-clinical areas you're billing for your patients. And the fourth is your schedule, basically how busy you are. Practices with a tight schedule will generate a lot more revenue than those with a loose schedule. Here's where your staff comes in, and the right staff is worth their weight in gold. The right front office person is worth her weight in gold. So those are the 4 drivers of revenue for the practice. The good news is there are lots of experts out there who can help you figure out how to maximize all 4. And that is my expert tip.